Welcome back to On Coffee podcast. I'm your host Vahe, and today we have a special guest, Dr. Brian Chernak, who is attending physician at Memorial Sloan Kettering Cancer Center. Dr. Chernak was a fellow at Columbia University Medical Center and a recipient of the 2023 Conquer Cancer Young Investigator Award. He also has a deep passion for sports and architecture, and I'm excited to dive into both his professional journey and personal interest. Dr. Chernak, welcome to the show. It's nice
Thanks
to
very
have
much
you
for
here.
having me about it.
So before we dive into oncology and your personal interests, I want to ask a question, and I think this question is going to be our traditional question. So what is your go-to coffee order when you need an energy boost for a busy day?
Well, that's a great question. I'll be honest, and I didn't really drink coffee until about my third year of medical school. And I went from having coffee with some cream and some sugar like my mom used to have growing up to having no cream, to having no sugar, to having just black coffee.
Yeah, that sounded like great choice. I'm sure the energy boost is much needed given your busy schedule in both research and patient care.
Yeah, I mean, I think I got used to it during getting up so early for med school and getting lazy. And then I just got used to it. So now I like to say I prefer the taste of just coffee without anything else. And being in New York, I'm spoiled by excellent coffee shops anywhere I go.
Yeah. So do you like to make your own coffee or you like to buy it?
Simplicity's sake, there's an espresso at home, which is all we really need. So I guess you could say a little lazy on that too.
Yeah, that's great. Great choice. So, Dr. Chernak, I know you're a big Mets fan. I have heard you could talk baseball all day. Was there a particular moment in your life when you realized you loved baseball, or was it a more gradual obsession?
Oh, I've loved sports since I was a kid. I went on to be a professional baseball player for all the way through high school, to be honest. But yeah, I mean, I grew up watching every kind of sport and playing every single one imaginable. And so whenever there's an off day or a little break between schedules, you'll see me checking in on the box score of the Mets, which hopefully we'll be doing a little more winning than losing this year as we did last year or so.
Yeah, I got it. I can tell you're a big Mets fan. What are your thoughts on how the team's doing this season? Any players you're especially excited about?
I mean, we have to be excited about Juan Soto coming over this year. It's been nice to kind of be the big bully in New York a little bit and get the big name players. But hopefully the pitching staff holds up this year, and we'll see. The beginning's been a little touch and go here, but pitching staff's holding up. So fingers crossed, it's going to be certainly an exciting year in the NL East. That's for sure.
Yeah, finger crossed. I have. So, being such a dedicated Mets fan, do you have any game day rituals or traditions? How do you like to watch the games? Because I know baseball is not just a sport; it's also about a culture. And lots of baseball players and fans they have rituals that they do before the game. So, do you have any of them?
So I don't when watching the games, but I think it's pretty funny that in medicine I've learned to not be superstitious and to not kind of hold on to old beliefs without looking up recent literature or the recent data. But as a baseball player growing up, never touched the foul line. I never ate seeds or gum when I was playing because I played worse when that happens. I had a ritual before how to warm up every single game, and I think that kind of has stuck with me. I could tell you everything I did before every game growing up.
Yeah, that's great. I always wonder how medical school can change lots of things about a person. Yeah. Are there any other sports you love to watch, or I don't know?
You name a sport, I have played it or I'm continually watching it. I can tell you about the NBA game last night. I can tell you about how the Bills are going to do this year in football. Josh Allen's got a special place in our heart from a native upstate New Yorker. But yeah, I mean, sports is kind of the way that I guess, de-stressed and learned how to put in a lot of effort growing up. So any chance I get to kind of follow up on it, it's a great way to kind of care deeply about something that ultimately doesn't matter outside of medicine, which can be stressful. And stay connected to a lot of my college friends, med school buddies, that sort of thing.
That's great stress relief. Yep. Moving on to something else you're passionate about, it's architecture. The Pantheon is one of your favorite ancient buildings. What about it stands out to you?
It's beautiful. It's the inside of the dome is just so symmetric and perfect that it kind of gives you like an optical illusion no matter where you are. And I visited it, I think, about 13 years ago, and you'll realize how amazing it is that this concrete dome with a hole in the middle of it. The perfectly recessed, kind of work in the ceiling was done 2,000 years ago and is still standing and is still essentially perfectly intact. It's remarkable.
It's incredible how structures like the Pantheon have stood the test of time. The Pantheon's dome is such an incredible piece of architecture. I still wonder how people back then, lacking the technical support, have built such incredible buildings. Thinking of that always fascinates me. Yeah, it's really beautiful. So you also travel a lot?
Yeah, travel a good amount. I mean, not as much as I did back in college and stuff, but it's been nice to have some time on vacation and go see some unique places. That's for sure.
If one day in your life you want to visit Armenia, I'll be honored to show you the old churches of Armenia. We have like great architectural pieces here, so it would be my honor.
Absolutely, yes. I would love to.
One of the other buildings you're passionate about is the Hearst Tower in New York City, in your hometown. What draws you to that building?
The Hearst Tower itself, it was actually when I was growing up in Rochester. Once in a while, we fly to New York, and there was a nice, really, really nice route on the flights where you would kind of fly south down the Hudson River and then make a U-turn and fly up the East River and usually land in LaGuardia. And for some reason, the geometric architecture of the Hearst Tower, it's kind of got like an octagonal block on top of another one, all glass and shaped by little triangles that when I was little, we would fly out of New York. That was the one building I'd always see how long I could see as we kind of circled around this beautiful tour of New York. And then kind of moving here, I don't know. I love how it looks. The base is a little bit older from the 1900s and it was never finished, but this glass kind of parametric architecture is just so distinct anywhere. And so I have loved just walking by it and pointing it out, probably annoyingly, to all of my friends and family whenever I get a chance.
Yeah, I got it. It's fascinating how modern architecture blends technology and aesthetics. I can see how your interest in both history and modern architecture could provide a unique perspective in other aspects of your life, even in the medical field. And I remember when I was in school, we had a guest. He was an architect who mentioned how the architecture around us can really shape creativity. Many great artists and writers come from cities with strong architectural identities, like Florence, where the Renaissance buildings inspired artists like Da Vinci and Michelangelo, or Paris with its beautiful landmarks and Eiffel Tower. And of course, New York with its iconic skyline and landmarks like the Empire State Building. I think there is no coincidence that New York, London, Paris, Milan are the hearts of fashion, of modern fashion. I think those cities have something to suggest the designers. I don't know. The designers, I think, are inspired from the architecture of that cities. What do you think about it?
Well, I love the fact that you just mentioned Paris and Florence, because the two main international trips I've taken the last 2 years were to Paris last July and then to Florence two summers ago for away, which Florence was just amazing. We talk about another dome, the Duomo in Florence. Oh, just beautiful. There's a place in Florence called the Palazzo Medici that has every floor of this like villa is a different style of the Greek architecture and Roman architecture of the different columns. So it's I believe it's Doric on the base, Ionic in the second floor, and on the third floor it's a little bit different. I think I may have made that up. Probably shouldn't talk about that. It's different texture on the different rocks, I believe. But
Yeah.
Florence, regardless, Florence and Paris were the two cities I just mostly recently went to, and yeah, beautiful. Just everything about it just feels very, I guess, unique. A little bit of ancient history in Florence and a little bit more of kind of modern, just like beautiful streets and cafes everywhere on the street. It just makes for a really nice place to walk around, makes you feel at ease.
Brian, I see you have a big passion for sport and architecture. Why you didn't continue in these ways, but you chose medicine?
Well, as I mentioned before, I wanted to be a professional baseball player all the way through junior year of high school. And then I actually started to really like architecture and thought about becoming an architect.
Yeah.
So I guess I ended up stumbling into medicine, I think more based on a couple of things, which was my mother was a nurse in the neonatal ICU for my entire life. And I did always like that, she kind of always knew how to take care of us, even though if I was whining or crying about a splinter, she was a little tough on me sometimes. But mostly it was becoming a lifeguard. And I think really my mother, both my parents' suggestions, I really liked being responsible for other people. And I kind of enjoyed at least knowing the basics of what first aid was, or, kind of emergency preparedness. The one thing about being a lifeguard, which I really enjoyed, was those couple of things realistically. But what I remember is those books that we would learn about, or read about, in terms of what happens if someone has stopped breathing, or what happens if someone falls and breaks their arm. Is the last step of every single one of those books is wait for EMS or wait for trained professionals to arrive. And in my head, all those times I was a lifeguard, I always thought in my head saying, man, I'd love to be on that end of things, right? Like, I want to be that trained person, to be the person at the end to tell people either, hey, it's going to be okay, or do my best to do what I can to kind of help either save their lives or, do what I can to stabilize them. I was talking to my parents about this last week, and they mentioned that the one thing they remember is there was a woman on the second floor of the YMCA that I worked at who had, I think she fell off the treadmill because she was kind of unconscious. And, my boss was an EMT and he was trained to go up there. I went up with him and he kind of helped stabilize her. But I remember it was as simple as like she was hypoglycemic and needed a granola bar or something. And I went down to get the granola bar.
Yeah.
And I think that was, apparently I went home and I kind of told my parents how, I helped help this woman out. That was, kind of silly, but in my head, they could tell how kind of excited I was to do that kind of thing. So I think those things are really the reason why I started to switch towards a medical field. And, just enjoying science, I think, is an important thing, whatever kind of science you like, to make sure you do enjoy when you go into medicine.
Yeah, it was really interesting to know your motives to apply for a medical school. But I'm sure your passion for sports, the mindset that requires sports, and the creativity for architecture are always helping you during your medical training and also your patient care in the clinic.
I think there was a time in med school that I felt like I shouldn't necessarily be taking time away to do those things. And I think it was to my own detriment to some degree. I've had some really great friends, even in medical school, who have made sure that I socialize and go out and be stressed. But I think especially the longer that you go through the training process, the more important those things are. Because ultimately, when you become an attending physician, you're done with training, you have to have a normal life. And so those things that I did kind of almost as like de-stressing or sometimes procrastinating measures are now the things that I still deeply care about and let me, have both a personal and a professional life.
Yeah, throughout medical school, we almost all the time forget about the things we care about that really can help us to do good in medical school. But we are always trying to do our lessons, trying to attend to the classes, and forget about the things that actually can help us to do better in medical school. Yeah.
Yes, my first and second year of medical school with all the exams was the 2 years the Mets made the second year was the year the Mets made the World Series. It was right during exam time, and there was definitely times I snuck up to the higher floors in the big classrooms, put up the World Series game on the projector, and tried to study.
Yeah. So talking about medical school, I know that medical school and residency are tough for everyone. Did you face any particular difficulties during your training, whether, I don't know, academically, emotionally, or just, I don't know, adjusting to the demands of the profession? And how did you overcome them?
Yeah, I mean, I think everybody struggles at medical school. It depends sometimes where, but there are so many ups and downs through all of it. And I think you're really tested, like, at least for me, no other way I'd done before. I was very good about showing up to class on time in college, taking notes, studying off those notes and kind of, regurgitating information. And there were, especially my molecular biology kind of related classes, I really enjoyed because they made you apply the knowledge you had learned in class on the notes to a new problem. So it wasn't about just memorizing certain facts, but it was about applying that knowledge. The thing in medical school was, instead of then doing that again, you're now left with 8 textbooks to consider, hours upon hours of lecture that you can't possibly learn. And it becomes a lot more about, not just memorization in the beginning, but also trying to, think about how do you have a foundation of facts that you do know, and then pick up little pieces of the more important things. For example, you need to know the different chambers of the heart and the different pressures and all the different, ventricles, the atria, and you have to be able to apply that knowledge. But also some of the things that you're going to learn about are not necessarily as critical to your understanding that you have. So I was trying to read like multiple textbook chapters in the first couple units of medical school, and I, got nowhere because I was so overwhelmed with trying to just do the assigned readings rather than realize that I can only learn so much, make sure I knew those facts as a good foundation, and then try to pick up some extra things. So for me, it was the first, especially, I would say, 2 years or 18 months for us of medical school that, I did well, but it was definitely very stressful and hard to adjust to that kind of mindset.
Yeah, I got it. I think all of the medical students face problems like yours, and it shouldn't stop us to do more. It shouldn't stop us to continue studying and trying to apply those knowledge, because as you mentioned, when you're not applying your knowledge, it equals to zero.
Yeah.
Yeah.
I think looking now too as well, right? There are obviously things that I do know and I'm very good at, and there's a bunch of things that I don't know or don't remember. But I think the important thing that I learned through medical school through that kind of standpoint was I don't have to know everything. I don't have to know more facts than other people. I have to really realize the things that I don't know and get really good at kind of synthesizing information quickly and coming up with the, correct answer or the, kind of right choice in a reasonable amount of time using sources that I trust.
Yeah, got it. Brian, medical school was tougher, but was tough, but residency I think is tougher. And you chose a specialty, hematology and oncology, which is a very stressful one. Why did you choose it?
Thinking into medicine, I kind of, for some reason, always gravitated towards cancer. The funny thing is I don't really know why. And I also know that while I did try to keep an open mind, and I have, most of my medical school friends did, change their specialty here and there. Many of them ended up in one of the fields they thought they were going into. But I was one of the couple that I wanted to go into oncology, and I never wavered from that. So, I knew I had to do an internal medicine residency, but the only couple of things I can point back to are, I had a couple family members, of course, that suffered from cancer, and I watched them go through that journey, while difficult. And, the other thing that I think really stuck out to me was actually going back to sports, which was the things that stuck out to me the most were many of the Sports Center Make-A-Wish clips that we'd see, especially in the summertime. Or, for me, I was in college, I believe, when this happened, but the ESPYs, which is the main ESPN sports award shows, that one of my favorite sports anchors at that time was Stuart Scott. And Stuart Scott was this, extremely kind of outspoken, very, very collegial, very charming kind of sports anchor who just would kind of throw random slogans out, yelling "booyah" every time they hit a home run. That I loved watching him every morning. And Stuart Scott suffered from appendiceal cancer.
Yeah.
He developed it, very rapidly. It's a very aggressive tumor, and most patients don't live very long on that with that disease. The things that I remember are that I saw him show will that I'd never seen before, which was someone going through chemotherapy and getting up, still trying to go to the gym, take care of his daughters, do all his wonderful things, meet other cancer survivors and tell them to keep pushing. And the other thing I saw was that he was on a clinical trial.
Yeah.
And he was trying to, he was working with these physicians. I can't remember if it was at Johns Hopkins or somewhere else, but that those oncologists gave him hope and gave him a, potential chance to live. And the things that I remember, my favorite quote from him during that speech was, that, you beat cancer by how you live, why you live, and in the manner in which you live. And I think those words have always stuck with me and really made me realize that, especially as an oncologist on the other side, that, I'm not going to cure every patient with cancer, but there are so many other things and so many other milestones and successes you can have along the way. Someone can live longer. Someone can have better quality of life. Someone can have hope when they weren't going to have hope. And those things, while I never really internalized it at the time, I would find myself going back to like the video of him giving that speech, or, kind of gravitating towards stand up to cancer during the baseball all-star game. That I think those things really drew me towards thinking about a field of oncology and what I wanted to be, to take care of people really at their, honestly, one of their most profound and most challenging moments of their life, no matter what the outcome was.
That's an inspirational story. Yeah, it's clear that you have found a meaningful path in your work. Chronic blood cancers can be complex, but they are also so important to understand and treat effectively. Can you share more about any recent advancements in the treatment of blood cancers that you find promising?
I think one of the great things about leukemias that I predominantly take care of is that there's a lot of interest in the field in trying to understand them both at a molecular level and, also to kind of investigate the microenvironment as being a potential trigger of these diseases. I think what we've seen, especially in the acute leukemia space and the chronic as well, is that we now have so many more tools in our arsenal. 10, 15 years ago, most of the patients that were getting treatment for acute leukemia, they're going to be admitted for weeks or months at a time. And we still have patients that, unfortunately, require that. But, in acute myeloid leukemia, for example, we're now kind of identifying specific mutations that we can target that have, novel targeted therapies that are included in our treatment plan. In terms of the chronic myeloid space that I see a lot more of, we've seen a lot more treatment options that are, somewhat a little more balanced in terms of mitigating some of the toxicities with trying to improve quality of life in some of these patients as well. Things that I can point to are some of the oral decitabine, which is a hypomethylating agent that we now use very often in many of our patients with myelodysplastic syndromes. We also have a bunch of, JAK2 inhibitors, including momelotinib and pacritinib, which are the newest kids on the block that can maybe improve some of the blood counts for some of our patients as well, that are certainly, promising new developments that, have been out in the field for a few years now.
That sounds great. It always fascinates me how fast science go, especially in medicine. Every day, every week, we have new things that help to improve patient care and help us to be a step closer to the cure of cancer. Brian, I know you have been awarded the 2023 Concord Cancer Young Investigator Award, which is such an honor. What does this recognition mean for your research, and how does it impact your approach to clinical trials and patient care?
The award is certainly a great honor, and I think as an oncology fellow, it's a really great kind of marker of realistically having a project that is, I think, well thought out. But I think most importantly is mostly a marker of recognition to your mentors. A lot of these young investigator, awards and the like, at least that I've applied for and, fortunately earned a couple of, are really great learning steps, regardless of whether or not you end up getting the award. So, what we did at Columbia, where I did my fellowship, was we had a fantastic grant writing program that really taught fellows like me how to write a grant, which I really hadn't done through a residency, of course, through medical school. And I think it helps me learn how to have a narrow focus of a project that could be attainable, no matter how sometimes simple the aims might seem to be. There's still important answers to be kind of considered. I had fantastic mentors. My, main clinical mentor, Dr. Azra Raza, has been a huge champion for me for several years, ever since I first met her. And my lab mentor, Dr. Stavrolo Kosteni, and Dr. Joe Jersik, who also works in the clinic as well, kind of helped come together with a kind of three-pronged approach of making sure that myself as a clinical fellow could achieve a laboratory-based project that would have some implications for the patients we were actively seeing in the clinic. I think, our work in the Kosteni lab in particular is really looking at how the microenvironment is potentially stimulating the development of these blood cancers like MDS and like acute leukemia. But I think it has some broader implications of just thinking outside the box. As I mentioned before, we're doing a really great job in oncology of finding targeted therapies for specific gene mutations that lead to a lot of cancers. But I think this project that we're working on is, while it's a novel development, is a way of kind of thinking, thinking differently and saying, hey, while we think mutations drive oncology, what about the importance of the kind of environment on the proliferation of this disease? As a new attending physician, it's also allowed me to not only have some recognition from that project, but also be a stepping stone for me to kind of help, undergo my own clinical projects that are, somewhat more translational in nature.
Yeah, that's really inspiring. It's amazing how words like this allow you to push the boundaries of what's possible in cancer treatment. You mentioned about your fantastic mentors, and also our prior guests mentioned about their mentors. And I think having a good mentor is a key to a success. They really help us during our bad times. When we need advice, they're there. And yeah, I think it's really important. You also mentioned about your own clinical research. Could you please give some insights about it?
Yeah, I mean, at Sloan Kettering, I see patients predominantly with myeloproliferative disorders, as well as some of these other chronic diseases such as MDS and systemic mastocytosis. So, working with Rajiv Rampal, who's the head of the myeloproliferative neoplasms program at MSK, we're looking at how kind of these different diseases are developing over time. So I think that's a really important concept of looking at the long game for these patients. In that a lot of our research, especially in the more acute cancer, is just looking at how the disease presents at the time of presentation. These chronic diseases, I think, really unique thing about them, which is why I love taking care of patients with these disorders, is that many of these patients have these diseases for 2 years, 5 years, 10 years, 15 years, 20 years. And we don't have a lot of evidence right now that suggests that, acting and performing a bone marrow transplant on a patient who has low risk polycythemia vera is the right thing to do. In fact, it's definitely the wrong thing to do. But obviously, at some point, as the disease progresses, it does become harder to treat those patients. And so some of the work that I'm, ongoing with some of my collaborators through our MPN Research Foundation is trying to look at kind of the longitudinal outcomes of these patients and seeing if we can predict which of these patients are going to progress a little in a kind of a unique fashion as to compared to some of the kind of older mechanisms by which this has been done.
Yeah, that sounds really interesting, and I wish you good luck with your clinical research. I hope you're gonna succeed. Brian, between your busy career in hematology and your passions for sports and architecture, how do you manage to balance everything? What advice would you give to our listeners who are mainly young professionals, medical students who are trying to juggle their career and personal interest? Because personally, me, I'm also struggling with that.
To be blunt, I was not the best at balancing things through, I think, medical school in particular, especially in the beginning. I think that's part of the reason I was so stressed in the beginning of school. I kind of tried to devote everything into it, whereas I'm a pretty well-rounded person. I have a lot of different interests that I do a good job of kind of doing a lot of other things. The two things I will say is that the people that were most important to me are my family and then my friends. And I think the two most important things were my parents never pushed me to go to medical school. They had me, they encouraged me to see if I wanted to, and they were then, more than happy to share my successes and my failures. But the important thing was they never put that stress on me that said you had to become the best person you needed to be. They never said that you have to be the best, right? My parents were happy and proud of me and wanted to support me. And of course they wanted me and expected me to do the best that I could. But I never felt that pressure from them that say that I had to get that, 90% on that, in that class. I had to get the high pass or honors in this rotation. I never had to get that paper out. They never put that stress on me. And I'm eternally grateful for them for that. The other people are my friends. I had a lot of great friends from college and, in the beginning of medical school, they were there to help me de-stress. And then realistically, I have a lot of really great medical school friends that while I was the one sitting in my room trying to study, away from them, they were the ones that would drag me out and say, hey, man, like it's a Friday. Let's go grab some dinner. Let's go out and have a drink and just kind of relax. They've been the medical school friends from SUNY Darmstadt have been fantastic. And as the years have gone on, we still are in touch all the time. I'm about to marry one of them, who is honestly my biggest support network, and is that she honestly works harder than I do and yet still has time to, spend time with family, spend time with friends, go to try new restaurants, and try to remind me that, as I mentioned before, that having a balance is way more important than just being just trying to get the best score that you can on that test, because you will burn out.
Great advice. Balancing personal and professional life is something a lot of people struggle with. It's clear that you have found a way to make it work and still have time for things you have. And you also mentioned about the support of family. I think it's really important because med school is hard, and if you are forced to study medicine, I think it's even harder because sometimes I choose to become a doctor, and during med school, I think what I'm doing here. And if a person who's forced to become a doctor, I can't imagine how he's doing because it's really hard. And also the friends, one of my friends also always says that university is not for studying. You can study at home with your laptop. University is for making friends and connections. And I always try to follow that advice.
Yeah, I mean, I think I have some great friends, especially from college. Some of my roommates are some of my closest friends. And from medical school, what's been really nice is we're all in different fields. But it is nice to just kind of get back together and, chat about, this happened at work, or having stress about, how residency hours were going, and, this shift has been crazy. All that stuff was really important just to have that support network from people that are also going through the same thing. I think I would not be here without all of them today. That's for sure.
That's incredible how your relatives and friends can do for you. They always support you, and that's very important when you're done. That really matters. Brian, thank you so much for sharing your expertise, passions, and insights with us today. It's been such a pleasure talking to you, and I'm sure our listeners have learned a lot. If they want to follow you, follow your work, or get in touch, where can they find you?
I'm a little invested in starting the attending career life, so I haven't delved too much out into the professional social media world, but certainly folks can follow me on X, and certainly can otherwise find me on LinkedIn for that matter. I think my next steps are to make myself more available out in the social media world, and hoping this can be a stepping stone for that as well. So thanks very much for having me join, and get our thoughts out there.
Thank you again, Brian. And to our listeners, be sure to tune in for more engaging conversation on the On Coffee podcast. Subscribe to our channel and keep the coffee brewing. Until the next time.